Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hello, my name is Tita Montero. I'm a volunteer with the Senior Advisory Council at Northwest Seniors and Disability Services. Today, I'm interviewing Melissa Bush. She is the Democratic candidate for State Senate District 16. I will be asking questions related to seniors and people with disabilities. Welcome, Melissa. Thank you for sharing your time with us today.
Thank you so much for having me. I'm happy to be here with you.
Great. We'll get started right away. So, first question, tell us about your platform and experience that would encourage a senior or person with disabilities to vote for you.
Thank you. My name is Melissa Bush, and I'm running for State Senate for District 16. I'm representing the northwest portion of our state, so Columbia County and the North Coast, including Clatsop County and Tillamook County, and some rural areas of Multnomah and Washington counties as well. So sorry, I have furry friends in the background that, of course, decided to chime in right now. A bit more about myself. I'm a nurse in our community, a home health nurse, and I spend my time visiting a lot of folks that are seniors and people with disabilities in their homes. And the work that I do really has given me a really in-depth understanding of the issues that are impacting a lot of our community members, especially our most vulnerable folks in the community. And that's really why I'm running, is because of the things that I see every day with our most vulnerable seniors, people with disabilities, and folks that are really just struggling to access care in our current system. So that's, I think that's what gives me that unique understanding.
Great. So tell us what you know about OPI and how it improves the lives of seniors and people with disabilities?
Over the years of my work, both previously when I worked in the hospital setting and now in the community home health setting, I've worked with a lot of community members that have utilized OPI services, as well as other in-home care services. And I have seen what incredible difference it makes in people's lives. And really allows our senior community and people with disabilities to be able to remain in their homes, which I think is so critical. I have helped folks get connected with OPI services. In my role in the hospital setting, I worked on the inpatient rehabilitation unit. So I worked with a lot of folks that were either experiencing new disabilities or, a change in their ability to be independent at home. And so I have a really in-depth understanding of what that looks like for people when they're trying to navigate those resources and make sure that they have the support that they need to be as independent as possible and also safe in the community. Oh, you're still muted, Tita.
I thought I had unmuted. Thank you.
No problem.
How would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to an increasing senior and population and people with disabilities population?
Well, I know that OPI is such a good use of state funds, that it's a model that delivers those needed services to people in their homes and in the community at a much more affordable rate in terms of the amount that state dollars or how far those state dollars go. And I would really like to see an expansion of those services to more people in our community. Again, from my work in home health, I know what a critical difference it makes for people to have those resources and support in their homes in terms of just meeting basic daily needs. And I see a lot of people, even when they're tapped into the resources, not quite getting an adequate amount of support. And if they even just had a few more hours of support in the week, that can make or break their ability to stay in their homes. So I really would like to see an expansion of those services at the state level and making sure that we're not leaving any of our elderly and disabled community members behind.
Thank you. During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face a lack of accessible, affordable housing and receive appropriate nutrition?
Absolutely. I do see folks, unfortunately, really struggling in this area. I know that with the increased cost of housing, that people on fixed incomes are struggling to meet those needs. And I think that when it comes to where the state is spending their dollars, that we really need to be thinking about our budget as a moral document, and that where we invest the money at a state level really speaks to what our values are. And so I would like to see increased investment in creating affordable housing solutions for people on fixed incomes, really increasing the number of properties available to expand those services, and also an increased investment in how we deliver food support to the communities. I think that, we have a lot of our community food banks that are doing incredible work. And those, nonprofits need all of the, grant support and financial support that they can get to deliver, meals to folks that have a hard time either making their own food or getting into the community to do their own shopping. So I think that those are both opportunities for us to really invest at the state level so that we're making sure that no one's going unhoused and no one's going hungry.
Thank you. And this is the last question. What would you do as a legislator to address the behavioral health issues that have been brought on by health issues and isolation related to the pandemic?
Absolutely. Well, I mean, I think that there's a lot of different things that we can do to help support behavioral health. And I know from my work as a nurse that behavioral health is part of comprehensive healthcare, and we need to drastically expand access, especially in communities like ours here in Senate District 16. We have very limited resources and not enough behavioral health, providers to meet the demand that exists. So I think that, we need to, again, be looking at our funding model to make sure that we're really heavily investing in behavioral health, and that those investments are that the dollars that are set aside and allocated are being used the most effectively to expand services. So I think we need to be collaborating with our providers in the community to make sure we understand what they need to be able to deliver those services to people in the community. I think that integrating some community models similar to what we provide with home health, where we're actually able to get out into the community and provide those services, and making virtual visits and things that are accessible to people is very important, and continuing to make sure that providers are reimbursed so that they can provide those services in a manner that allows them to be sustainable. I also think that expansion of services like OPI and in-home care in general, that goes a long way to support people's behavioral health, even if it's not directly providing, for example, counseling services or medication management, but just to have that issue of isolation addressed, that so many people over the last several years have been alone, and that's really impacted the overall mental health and behavioral health of a lot of our community members that already maybe struggle with that in the first place. So making sure that we have people visiting and just spending time with our aging community members and our community members with disabilities, so that they don't feel so alone and isolated. But I think, these are definitely areas that I'm deeply committed because I know from my firsthand experience just how important that these issues are to the overall health and well-being of our most marginalized and vulnerable community members.
Thank you. Well, that's all our questions. So I want to thank you, Melissa, for spending a portion of your time answering our questions and focusing on seniors and folks with disabilities. Again, this is Melissa Bush, running for State Senate District 16. Thank you, Melissa.
Thank you so much for your time. I really appreciate it.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.